One looks back at the global pandemic and how COVID-19 affected so much of the world, one does wonder, why was it that Sub-Saharan Africa was nowhere near as badly affected as much of the rest of the world? This stereotype is that Sub-Saharan Africans would not be able to cope with public health emergencies. They lack the infrastructure, the knowledge and the understanding, the medical facilities, and yet far fewer people died of COVID-related illnesses in Africa than they did across Europe and North America. Now, there are a variety of reasons why this is the case. Partly because governments actually acted very quickly to the public health emergency and took precautions from the very beginning, unlike some of their counterparts in Europe and North America and other parts of the world. I remember the beginning of the outbreak of COVID-19, going to Zambia and landing in Lusaka and being tested for COVID-19 and having to provide my address and my details of where I'd be staying in Zambia to public health officials. Whilst when I entered Brussels and London at a similar time, within a 2-week period, none of those details were asked for and I wasn't checked or tested for anything. There was much more of a blasé attitude in Europe towards COVID-19, despite the fact that the virus is having a deadlier effect in that part of the world. Now, another public health issue which I think is worth drawing to attention of the world is the fact that culturally, Sub-Saharan Africans across virtually every country in Africa will wash their hands before eating, after using the bathroom, after performing menial tasks which involve the use of the hands. Hand washing is a cultural norm and something that people do all the time. And as we now know, hand washing was one of the measures which the World Health Organization advised in order to avoid contacting COVID-19. So Sub-Saharan Africans, just because of the fact that they live clean, hygienic lifestyles, were ahead of the game. Perhaps we could learn from Africa in other parts of the world. I know we can learn from Africa, but how many people do?